ductus arteriosus, or PDA, is a heart condition affecting newborns. It involves a blood vessel in the heart, the ductus arteriosus, which doesn't close after birth as it should. This opening allows blood to flow in an abnormal direction, potentially leading to heart and lung problems. PDA is more common in premature babies and those with genetic conditions. Raising awareness about PDA is crucial for early detection and treatment, ensuring the best possible outcomes for affected infants. Understanding PDA is the first step towards ensuring that newborns receive the necessary care. It's not just a medical term, it's about a tiny heart working overtime. Parents, caregivers, and healthcare providers must be equipped with the knowledge to identify and address this condition promptly. The impact of PDA extends beyond the individual child. It affects families, communities, and healthcare systems. By understanding the causes, symptoms, and treatment options for PDA, we can collectively work towards better prevention and management of this condition. Early diagnosis and treatment can make a world of difference in the lives of children born with PDA. Let's delve deeper into the science behind this condition and explore the signs that parents and caregivers should be aware of. In a fetus, the ductus arteriosus plays a vital role. This blood vessel allows blood to bypass the lungs, which are not yet functioning. Oxygen is received from the mother. At birth, the baby takes its first breath and the lungs inflate. This change triggers the ductus arteriosus to close within the first few days of life. However, in cases of PDA, the ductus arteriosus remains open. This allows oxygen-rich blood from the aorta to mix with oxygen-poor blood in the pulmonary artery. This disrupts the normal flow of blood, forcing the heart and lungs to work harder. Over time, this can lead to several complications. If left untreated, PDA can strain the heart and lungs, leading to heart failure, pulmonary hypertension, and other serious health issues. The severity of these complications depends on the size of the opening and the overall health of the child. Early detection and treatment are crucial to prevent long-term damage. Understanding the biological mechanism of PDA provides valuable insights into the importance of prompt medical attention. By addressing the condition early on, we can minimize the strain on the heart and lungs, allowing the child to thrive and grow without the burden of this condition. Symptoms of PDA vary depending on the size of the opening and the age of the individual. In infants, the signs are often subtle and may include rapid breathing, poor feeding, and slow weight gain. These symptoms can easily be mistaken for other common newborn issues, making diagnosis challenging. As the child grows, more noticeable symptoms may arise, such as shortness of breath, fatigue, and a bluish tint to the skin, particularly around the lips and fingertips. This bluish discoloration, known as cyanosis, indicates a lack of oxygen in the blood. If you notice any of these signs in your baby, it's crucial to consult a pediatrician immediately. While PDA is typically diagnosed in infancy, some cases may go undetected until adulthood. Adults with PDA may experience fatigue, shortness of breath, heart palpitations, and swelling in the legs and ankles. In rare instances, PDA can lead to more serious complications, such as heart infections or stroke. Recognizing the signs of PDA, whether in infancy or adulthood, is crucial for seeking timely medical intervention. Early diagnosis and treatment can significantly improve outcomes and reduce the risk of long-term health problems associated with this condition. Treatment for PDA depends on several factors, including the age of the patient, the size of the opening, and the severity of symptoms. In some cases, the PDA may close on its own, especially in premature babies. However, most cases require medical intervention to correct the defect. For infants and young children, minimally invasive procedures are often the preferred treatment option. These procedures involve inserting a small catheter into a blood vessel in the groin and guiding it to the heart. A device is then inserted through the catheter to close the PDA, restoring normal blood flow. In older children and adults, surgical closure of the PDA may be necessary. This involves open heart surgery, where the surgeon makes an incision in the chest and repairs the defect directly. While surgery carries more risks than catheterization, it is often the most effective option for larger PDAs or those diagnosed later in life. Early diagnosis and treatment are crucial for minimizing the risk of complications associated with PDA. By addressing the condition promptly, we can allow the heart and lungs to function optimally and prevent long-term health issues. Section 5. Preventing PDA, a shared responsibility. While there's no guaranteed way to prevent PDA, several factors can significantly reduce the risk. Expectant mothers can play a crucial role in promoting their baby's heart health by adopting a healthy lifestyle during pregnancy. This includes maintaining a balanced diet, engaging in regular exercise, and avoiding alcohol and smoking. Prenatal care is paramount in identifying potential risk factors for PDA. Regular checkups and screenings allow healthcare providers to monitor the mother's health and the baby's development, ensuring early detection and management of any complications. Early intervention is key to minimizing the impact of PDA on the newborn. Beyond pregnancy, regular pediatric checkups are crucial for monitoring the baby's growth and development, including heart health. Pediatricians can detect subtle signs of PDA that parents might miss, allowing for timely intervention and better outcomes. Early detection is particularly crucial for premature babies, who are at a higher risk of developing PDA. Preventing PDA is a shared responsibility between parents, healthcare providers, and the community. By promoting healthy pregnancies, ensuring access to quality prenatal care, and scheduling regular pediatric checkups, we can collectively work towards reducing the incidence of this condition. Early detection of PDA is crucial for ensuring the best possible outcomes for affected infants. When PDA is identified and treated early, the heart and lungs have a better chance of developing normally, reducing the risk of long-term complications. Early intervention allows children with PDA to live healthy, active lives. Pediatricians use a variety of methods to diagnose PDA, including physical exams, listening to the heart with a stethoscope, and performing imaging tests such as echocardiograms. An echocardiogram uses sound waves to create pictures of the heart, allowing doctors to visualize the PDA and assess its severity. Early detection often means less invasive treatment options. In some cases, medication can be used to close the PDA, eliminating the need for surgery or catheterization. Even when procedures are necessary, earlier intervention is associated with better outcomes and faster recovery times. The benefits of early detection extend beyond immediate health outcomes. Early diagnosis and treatment can alleviate the emotional and financial burden on families, allowing them to focus on their child's well-being without the added stress of managing a complex medical condition. While PDA presents challenges, it's essential to remember that it's a treatable condition. Many children who undergo successful PDA closure go on to live healthy, active lives without limitations. Their stories offer hope and inspiration to families facing a PDA diagnosis. Take, for example, the story of Sarah, a vibrant young girl who was diagnosed with PDA shortly after birth. Thanks to early detection and timely intervention, Sarah underwent a successful catheterization procedure and has thrived ever since. Today, she enjoys playing sports, excels in school, and lives a life unburdened by her early heart condition. Similarly, Michael, a teenager diagnosed with PDA in adulthood, underwent surgery to close the defect. Despite facing a longer recovery period, Michael is now back to enjoying his favorite activities, including hiking and playing basketball. His story highlights that PDA can be effectively managed even when diagnosed later in life. These stories of resilience and hope underscore the importance of raising awareness about PDA, promoting early detection, and ensuring access to quality healthcare. By sharing these stories, we can empower families facing a PDA diagnosis and inspire hope for a brighter future. The field of PDA treatment is constantly evolving, with new technologies and techniques emerging to improve outcomes and minimize invasiveness. Minimally invasive procedures, such as catheterization, have revolutionized PDA closure, reducing recovery times and minimizing complications. Researchers are exploring even less invasive techniques, such as using bioabsorbable devices that naturally dissolve in the body after closing the PDA. These advancements aim to further reduce the risk of complications and improve long-term outcomes for patients. Another area of advancement is in the development of personalized treatment plans. By considering individual factors such as age, overall health, and the severity of PDA, healthcare providers can tailor treatment strategies to meet the unique needs of each patient. This personalized approach aims to optimize outcomes and improve quality of life. These advancements in PDA treatment underscore the importance of ongoing research and innovation in the field of pediatric cardiology. By pushing the boundaries of medical technology and embracing personalized medicine, we can continue to improve the lives of children born with PDA. The future of PDA care is promising, driven by ongoing research, technological advancements, and a growing awareness of the condition. As we continue to learn more about PDA, we can develop even more effective prevention strategies, diagnostic tools, and treatment options. One promising area of research is in the field of fetal cardiology. Advances in prenatal imaging techniques allow doctors to diagnose PDA in utero, opening up possibilities for early interventions that could potentially prevent complications before birth. Another area of focus is on improving long-term follow-up care for individuals who have undergone PDA closure. By monitoring for potential complications and providing ongoing support, healthcare providers can ensure that these individuals maintain optimal heart health throughout their lives. The future of PDA care is about empowering patients and families with knowledge, resources, and support. By working together, we can create a future where PDA is detected early, treated effectively, and no longer poses a threat to the well-being of children born with this condition.